Hey everyone, thank you. So Adiren Guenogo, I'm a radiologist and the CEO of RadioLogs, and Justin Regef will speak after me and he will explain all the AI process. So I will just briefly introduce you the solution and our company and our philosophy. So RadioLogs is about quality in medical imaging. What we do right now is we have a first product, which is a platform for second medical opinion in medical imaging, radiology, and nuclear medicine. So we have human experts, not AI for now, but human experts. So radiologists who are specialized in different parts of the human body. And as a patient, if you want to ask for a second medical opinion, then you can just send your X-ray, CT, or MRI on the platform and ask for this service. And now, that we do that, we really improve the quality of the reports. But the point is, when as a patient you receive a report, so most of the time you have like very specific and details about the MRI, the CT, but most of the time you don't understand it, and sometimes you have like errors in the report, so you don't know exactly what happens, what will happen, and you don't know what to do, and you don't know how to understand this report. And sometimes even your general practitioner doesn't understand all the details in the specialized reports. So that's where our AI tool will be very important. We will try to tackle this specific issue by improving the quality of the report for the radiologist and for the patient. So the idea is to correct the report for the radiologist, because most of the time when you see like 80 or 100 patients a day, then you don't have time to read your report and verify that you don't make any mistake. So you improve it on this way. And for the patient, you improve it by vulgarizing it and giving a lot of more information directly to the patient. So he knows where to go. He knows if he has to consult another physician, if he needs to do a new MRI, a new CT. That's something that is really missing right now. So that's where Justin will help.
All right, thank you, Adrien. So before I talk about exactly our problem and our potential solutions, I want to elucidate a little bit about the two main themes that go wrong with our AI research, which is that of agentic systems and data sovereignty. So you can think of an agentic system as something quite simple. It's just an LLM, but you give it a bunch of tools and a bunch of access to other things that are not just chat. And you say, hey, if you need help, let's say from a database, or if you need some kind of image understanding, for example, in our case, with radiology exams, then it has access to these tools. And that of data sovereignty is, of course, very important in the field that we're working with. And this is why we want to focus on doing the very hard research goal, which is to run an LLM locally. And we do that by actually quantizing and compressing. And I just had to speak with NVIDIA people about distilling models and pruning them and making them able to run on like relatively affordable GPUs. So what we want to do with the AI, and this is the rough framework of like an agentic system that uses RAG, but what we want to do is you give it the images, you give it the data of the patient history, and you give it the radiologist report, and it has a bunch of tasks it can do. The big one that we're really interested in targeting is detecting diagnostic errors. There's established research that shows that even just ChatGPT without a augmented retrieval system can already retrieve a bunch of like diagnostic errors and then flag them and increase the throughput of the doctors. And then something else that we want to do is also be able to take those very complex specialist reports and make them more accessible for patients by breaking them down, explaining all the technical terms, explaining or vulgarizing different observations by the doctor. And so how do we do that? Well, it starts with a big language model. We're agnostic to which language model we use. And what we have is data, which is, for example, downloading the entirety of Wikipedia, PubMed, and now we're striking deals with hospitals about like getting also the corpus of their anonymized reports and patient histories. And then a retriever, which can look for specific queries inside this corpus, which is like, for example, Google search, right? And it's actually quite an interesting but difficult field of research. And then putting all that together, you give the LLM an enhanced prompt with inside the context window, the data that it has. Now we're also planning on augmenting this with image understanding. So for example, appending a segmentation or object detection model that we will train or partner with other startups that will then be fed into the agentic system that can then use all this data and tools. Now, something that's interesting is that this can be done locally. You just need a lot of SSD, a lot of storage. This is an interesting field of research when it comes to doing it locally because it's already pretty small models. So technically, you can just run it on your laptop, like your MacBook, for example. But every week, there's a new paper saying, well, actually, we managed to make it 3% of the size it was before and still have 95% of the accuracy, for example, with binary quantization of the retriever model. So that's very promising. And then there's the elephant in the room, which is how do you run a language model locally? And we have seen some very promising news recently, and this is why it has spurred our research interest into this topic, which is that 30 billion models of today are doing what ChatGPT was doing last year. And though there are rumors of OpenAI plateauing and that kind of stuff, it seems like the research for making smarter, faster, lighter, and more competent LLMs is very much a very active field of research. Just think of the NVIDIA Nematron or Gemma 2 billion or, of course, Llama 3.2. So you have an LLM, you have a bunch of tools, you want to run it all locally. And why do you want to do that? Is because doctors, even if our servers are certified HDS, which we will offer an online alternative, which will be certified HDS, they still don't want to send the patient data or the patient history to something in the cloud. And we also feel like we are beholden to medical practitioners to have auditable open code that they have ownership of, which is something that is very important to our mission. So this is just a brief overview of our stack, and what we want to focus on is pooling a lot of tools from the open source community to accelerate our research, as we're quite a small startup yet, and then leveraging a bunch of competition that is happening with the big players to use their open source tools for our purposes. So yeah, that's quite interesting. Maybe I'll give it to you for.
So yes, that's the main area of development we are in. Do you have any questions about our services? Either the first one, you see it's snowing a lot, so if you fall, you get an X-ray, you can send your images in case.
I had an error of diagnosis 2 months ago.
Sorry for that.
So I can send you my...
No, my auntie's breast cancer was my aunt's breast cancer diagnosis was delayed for a few months when they missed a tumor that when you went back to the first exam and you look at the original thing, it was really glaring in terms of a medical error. And this is the kind of error that we believe that we can catch with these agentic systems. Something that's also interesting is that the risk of AI in healthcare is obviously something that cannot be understated, specifically when it comes to diagnosis. This is why we believe that something that is auxiliary or redundant to the doctor's work as a starting off point makes sense. So we're just proofreading the diagnostic errors and that kind of stuff.
From my understanding, I came in late, so I'm super sorry if I misunderstood. But it sounds like it's an asset to people who are already specialized in reading the radiologs, so specialized in reading radiology. Can you imagine a tool like this to help, for example, generalist doctors who maybe don't have a specialized radiology?
Yes, of course. So that's something we have in mind. Again, as a radiologist, 5-6 years ago, I started the first company, and it was too wide, and we failed. And that's why, for this one, we really want to start in the sector that we know and where we know the people. So radiologists and specialized radiologists are our first target. But then the idea is to, of course, expand it to all radiologists, and then later to general practitioners or surgeons, because there are many things that are very close. We just need to have the good experts, the human experts, that will help to understand what are their problems and how we can help them. And then we need the data sets to train the models for that. But yes, first radiology, and then of course we will love to expand, but it will be maybe in 1 or 2 years, and we will need more money. So sure. Yes.
So the case where the tumor was missed, this is a false negative case. How you deal with false positive cases? Patient is healthy and the AI suggests, okay, you have a problem here, and he freaks out and loses weight and everything.
Well, for now, what we want to do is to help the radiologist. So for now, we don't want to do all the work of the radiologist. That's not what we want to do. First, we have human experts. And for me, the human experts still have kind of good expertise. And I think all these tools can not replace, but really help general radiologists, general practitioners in improving how they read the reports and everything. So we want to help them, and we don't have like the perfect AI tool that will tell you, okay, this is the images and it's this diagnosis. That's not exactly what we want to do. And in case, of course, of false positive, the idea is that these tools are always used by a human radiologist in this case. So you always have both views. And the radiologist is here to look at the images, and if he thinks that this is, the AI is suggesting something that is not true, then he has the last word. The AI do not have it.
So he can flag with results, false results, and improve the model?
Yeah. So this is like a specific choice that we made, that all AI tools will be only practitioner-faced. So the patient is never actually going to see the AI do anything. And then one of the biggest assets when it comes to safety is that within our agentic systems, we have human in the loop, which is essentially that they will always be able to interpret and see what is going on. And interpretability, we didn't get to speak on it that much, but is a future field of research that with more investment, we want to, focus a lot on. Yeah. But already having like an agentic system allows you to not just take the zero-shot prompting at face value, but you can actually see like every step that it took, all the documents it retrieved, and every like thing to see if there's an error anywhere. Yeah, and all of this will be logged.
Thank you.